Hello, it's Saturday, February 11th, 2023. This is Dr. Rhonda Johnson. Today I am talking about cancer risk factors. Well, a risk factor is anything that raises your chances of getting a disease. So today I'm talking about cancer risk factors. Now, different cancers have different risk factors, but having a risk factor by itself doesn't necessarily mean that you're absolutely going to get the cancer. So some risk factors can be modified or controlled, others cannot. So let's talk about risk factors that you can't do anything about. Your sex, your age, your genetics. You know, some of it's just biology. If you are not born with an ovary, a uterus, a penis, testicles, or a prostate, you're not at risk for these cancers because you don't have these organs. And some cancers are hereditary, meaning that you carry certain genes that increase your risk of developing the cancer that gene encodes for. Age, there are many cancers where a risk of cancer goes up as a person gets older, and then there are some cancers where the risk is limited to infants and children. Now, sociocultural risk factors in the United States weigh in heavily. Some cancers are much more common in people who are Hispanic or Latino, African Americans, Indigenous Americans, and Asian Pacific Islanders than in non-Hispanic whites. This is not due to genetics or biology, but due to long-standing inequities. Now, a lot of times these sociocultural risks can be changed through lifestyle intervention and behavioral intervention, which leads me to the next topic, behavior or lifestyle risk. You know, there are certain things that we do to ourselves that increase our risk of cancer. Number one is tobacco use. Smoking increases the risk for so many cancers and directly causes lung cancer, oral and throat cancers. Diet, many cancers are related to what we eat. Eating processed, grilled, or charcoal meats can increase the risk of certain gastrointestinal cancers, whereas eating lots of fruits and vegetables and raw fruits and vegetables appears to lower the risk of many cancers. Alcohol use is another culprit, a risk factor, and evidence is very strong for this. Any and all alcoholic drinks, including red and white wine, beer, and liquor, are linked to an increased cancer risk. When it comes to alcohol, folks, less is best. Then there's infections. We all know about HPV, human papillomavirus, and the risk of cervical cancer. But did you know HPV can cause cancer of the anus and cancer of the penis and cancer of the head and neck? That's why getting the HPV vaccine is so important. But that's not the only infection that's linked to cancer. H. pylori is linked to stomach cancer. Epstein-Barr virus, EBV, that causes mono, is linked to several types of cancer. Hepatitis infections are linked to liver cancer. So again, the causes of cancer, these lifestyle factors can be modified. Certain jobs, certain chemicals like benzene, asbestos, vinyl chloride, arsenic are known human carcinogens, and people who work in these chemical manufacturing industries may face a higher risk of cancer. And then there's obesity. Being overweight or obese is linked to many cancers, and so is physical inactivity. So in closing, I've been talking about general cancer risk. I realize this is just a partial. I may have omitted some of these risks, but this is enough to think about and to get started, because it doesn't matter if you're too young, you're not too young, you're not too old to make these changes to lower your cancer risk. Everybody wants to have a cure for cancer, but there are some things that each of us can do that can lower our risk factors, and we can start today. That's my message. Take care, folks. Be well and be safe.